Great. All right. So let's get started. So today what we're going to be talking about is the prevention of musculoskeletal injuries in the workplace. And we're going to be focusing on gripping tasks, gripping and pinching. Okay. So this is actually the final webinar of a series of webinars that we've been running about the prevention of injuries and musculoskeletal injuries in the workplace. We started with sustained or awkward posture tasks, so sitting, standing, kneeling, crawling, and reaching. That was done all the way back in April. Feels just like yesterday. The second one was lifting, carrying, and putting down objects. Then we did pushing and pulling tasks, which is roughly only a month ago. And today we're doing gripping. So reach out to me via email, and I'll put my email in the chat at the end of today's session. But you can just reach out to either workstrong.com.au or reach out to myself at amansweto@workstrong.com.au. And if you wanted to get more information or see the webinars, I'll be more than happy to pass those on. So today what we're going to go through is we're going to start with the impact of musculoskeletal disorders caused by gripping. So try and look at some statistics around gripping, the biomechanics of gripping, key injury risk factors, and then common injuries, and how to reduce then the risk of those particular injuries. And then we'll finish up with just a final gripping technique checklist that you can use in your business. Okay, once again, 60% of serious workers' comp claims are musculoskeletal disorders. So there's no point in hiding it. They are still the most prevalent cause of serious workers' comp claims. And of those musculoskeletal disorders, 38% are due to body stressing. So we think about the manual handling that's being performed in a business. That's what causes body stressing injuries, and they're 38%. So other causes of a musculoskeletal injury or a musculoskeletal disorder might be a fall, so a slip, trip, or fall. And then we've got other causes like being hit by an object. Okay, so in total, the total number of workers' comp claims across Australia, this is 2024 statistics, is 139,000, 6.6 claims per million hours worked. The median cost is 14 grand, and the median time is 7.2 weeks. Now, the first thing to look at here in this graph is that the body area. So Safe Work Australia has classified the injuries into different body areas. The area that we're concerned with today, and this is filtered for body stressing injuries only, is the upper limbs. So unfortunately, we can't get any deeper in terms of a categorization. So upper limbs would include still the shoulder, and it still would include the shoulder, as well as the elbow, the wrist, the hand, and the fingers. So the shoulder, we're not too much concerned with today because we're trying to focus on gripping, and gripping doesn't cause a shoulder injury. That's more under the categorization of lifting, carrying, and putting down objects. So just keep in mind, shoulder is still included in those 240,000 claims. Under body stressing, muscular stress while handling objects is at 25% of all work-related musculoskeletal disorders. And actually, I'll just go back one slide. It also might fall under, so gripping task might also fall under muscular stress with no objects being, under repetitive movement, low muscle loading. So, if somebody's repetitively gripping something, that might actually come under muscular stress, repetitive movement, low muscle loading. So the claims by the mechanism, so as we said, body stressing is the highest of those mechanisms. Now, this is interesting when we start to look at what is the breakdown agent. So yes, when we start to look at what's the breakdown agent, we've got non-powered hand tools, appliances, and equipment is the second highest. very close second at 28,909 serious workers' comp cases. Once again, this is across the whole of Australia. So that was actually quite surprising that hand tools and equipment and devices is one of the main causes of agents. So what we've got here is, just push this to the side. Great. So what we've got here is the breakdown agency versus the industry. So once again, we've got those non-powered hand tools, but we've also got powered hand tools and mobile plant and transport. And we've got the different industries which are categorized there under each bar. So the main ones being healthcare and social assistance, the construction industry, the yellow is transport, postal and warehousing. Excuse me. The blue one there is manufacturing, and the black one is retail. So the filters that we've put on this is body stressing. So we're only looking at body stressing serious workers' comp claims. We're only looking at the upper limbs. So once again, that does include the shoulder, but we're focused on the elbow, the wrist, and the hand. And we've only put down injuries in terms of a mechanism or the nature of the injury, which is the injury to nerves, traumatic joint and ligaments, and musculoskeletal and connective tissue. So what we've tried to do in this graph here is basically find out amongst the industries, what are the gripping injuries and based on what industry. The surprising thing to me was that the non-powered hand tools is the most significant cause of the injuries when compared to power tools. So I guess when looking at that, some reasoning behind that might be that power tools reduce the amount of force that is required to grip and to complete the task. So you might have a grinder and it's heavier, but you won't have to push hard because rather than sawing something, you won't need to grip and actually apply the movement and do the forces because it's automatic, it's powered. So it's probably something to keep in mind. And as suspected with the non-powered hand tools, the manufacturing industry has one of the most injuries at 10.8 thousand. And interestingly, healthcare and social assistance was the highest for non-powered hand tools, appliances, and equipment. So interesting. So as mentioned, also up there is transportation, postal and warehousing, and retail. And the purple one there is construction. Okay, so moving on now to the risk factors for gripping injuries. So this is an overview of just going to highlight. So this is an overview of the risk factors. So if you've got your musculoskeletal disorder risk factors, and they're broken down into one, which is individual or the human factor. And the second thing that is broken down into is the task factors. Okay. Now, the individual, we're thinking about these types of factors here. So the fitness level, the age, the level of training or skill of the employee, their clothing, how restrictive it is and how much movement is allowed, and their anthropometrics, so their height and their size. On the other hand, we've got the task factors that can be risk factors, and we're looking at the environment that the employee is working in, the physical requirements of that task. So, the load that they have to lift or grip in this case, and the movement. So how long are they doing this task for, the speed at which they're doing it, and the frequency. So that's the repetition. What are the breaks or the rest times in between, how often they actually need to do the task. And the last one there for task factors is organizational. So the space, time pressure, are they needing to work with a team member? Okay, those risk factors can be categorized in terms of gripping with force-related risks. So high gripping force is a risk factor, sustained gripping tasks or sustained static gripping, and pinch gripping. Then we've got the repetition and duration, which we mentioned. the posture and the ergonomics when you're gripping. So an awkward wrist position or finger position, small or poorly designed tool handles, and we're going to be talking about that a lot more later. The task requiring gripping while reaching overhead or in confined spaces, so the posture. And then the last two are the vibration and tool design. That's another risk factor specific to gripping. And the last one there is the individual and workplace factors. So lack of job rotation and or task variation. Cold environments will definitely be a risk factor that'll increase the risk of a tendon injury because there's going to be a lack of blood flow going through the tendon. And if somebody previously has a musculoskeletal condition, that's also another risk factor. So just think about it from if somebody is completing a task where they're gripping something. So in this case, this gentleman is gripping a nail gun. Those two different sets of factors. You've got the human factors. What's the age of this individual? Their height or anthropometrics, weight and size. The strength, how strong is he? And his technique and skill level. So for example, if he's very skilled, he'll relax his hand and he won't grip the nail gun tightly. And with experience, he'll know how much force is required to put pressure to ignite the nail gun rather than squeezing maximally with maximum force every single time. He'll know just the right amount of pressure to put. So that's the skill level. On the other side, we've got the task factors. How far does he need to reach to do the task? What's the weight of the nail gun? Thinking about also the nails that are inside. The task factors. How long does this job need to go for, or this task need to go for in duration? The frequency and the repetition. How many nails does he need to put in? And how many jobs does he need to complete, and how fast does he need to complete those jobs? So that's the frequency and repetition. And then his posture. How far does he need to stretch? Does he need to lean forward? And that's going to alter his posture. And then the environment. So how hot or cold the environment that he's working in. Okay. Now, I've tried to organize this webinar as best as possible to give you an overall understanding. It might seem a bit awkward that we're jumping now to anatomy, but I want you to have this foundation of understanding of the anatomy of the elbow and the forearm and the wrist and the hand before we then move on to the next part. So the first group of muscles I want you to understand is the forearm muscles and the flexor muscles specifically. So these are the muscles that originate in the forearm area, and they contribute towards pulling the wrist up, as you can see there, and also what we call flexing the fingers or bending the fingers. So think about somebody making a fist. You've got your hand and you squeeze to make a fist. It's these muscles that are in the forearm, if you're holding your palm up, that are controlling that movement. Okay, and the two main ones there are called flexor digitorum superficialis and flexor digitorum profundus. You don't need to remember these names. The most important thing to remember is that they originate here in the forearm area and they're attached to the elbow here. So this is the reason why if somebody is performing a gripping task and making a fist, they're actually potentially going to get an elbow injury, and that's the reason why. Okay, so if we look at the extensor muscles, now these are the muscles that are on the other side of your arm. So if you've got this side being the flexor side, if I turned it around, this side would be the extensor side. As you can see there in the video, I'll just play it again. And so these muscles are the extensors. Once again, the important thing to remember is not their names, but that they attach at the elbow. And this is important to remember because this is the reason why some people can get what's called tennis elbow injuries at the elbow from gripping. So the next area of muscles that I'd like to pay attention to is the intrinsic muscles of the hand. Okay. So there's different groups of muscles. We're not going to focus on the individual ones, but you've got the thenar, the lumbricals. I'll just pause it there. So these muscles here, these are called the thenar muscles, which control the thumb. These are called the hypothenar muscles, and they're muscles that control the small finger, the pinky finger. And then come over here. So then we've got the lumbricals. So these are small muscles that are situated between your fingers. And on the other side, just play that again. On the other side, these are called interossei. So the interossei are, once again, small muscles between the fingers, but on the dorsal side or the top side of the hand. Okay, now there's two main categories or different types of gripping that exist with the hand. So the first one is power gripping or power grips. So power grips involve closing the hand with the thumb in opposition to the other fingers. And the flexor digitorum profundus is the particular or the main muscle that's going to be producing that force. Once again, that originates in the forearm and connects into the elbow. And there's three different types of power grips: a cylindrical grip, a spherical grip, and a hook grip. So essentially, when you're bringing your thumb in opposition to the other fingers, that's going to be a power grip. And a precision grip thing. Yeah. So this is an example. This is a power grip. And as mentioned before, we've got the flexor digitorum profundus, the superficialis, and the thumb muscle, flexor pollicis longus, which once again does arise from the forearm area, is being used to make that fist. On the other hand, a precision grip can either be a pinch, a tripod, or a lumbrical grip. And essentially, these are grips for lighter devices. They're lighter grips. And the important thing to remember is that these grips are using the muscles that are in the hand. As explained before, you've got tiny, smaller muscles that are in the hand, and those muscles are being used to perform these kind of precision tasks. So that's these muscles. Okay, so controlling the thumb, controlling the individual fingers, and they help sometimes to open up the fingers, but also help close them, but with more precision. So the important thing here is to remember that we shouldn't be using these small muscles to be doing tasks where you're doing something that requires a lot more force. If it's a more forceful grip that's required, you should be doing a power grip. And if it's only a lighter task, then the precision muscles of the hand should be working to do those tasks. Now, one of the questions that if you're an astute student, you'd start to realize, why, if I close my hand and I need to grip something, why are both the muscles on the flexor side and on the extensor side working at the same time when I'm just closing my hand? And the reason for that is balance. So the flexors of the forearm, so the muscles on this side, just highlight it there, on this side of the forearm, these muscles, the flexors, they're actually stronger than the muscles on this side, the extensor muscles. They're a lot stronger. And so you need both the muscles activating at the same time to balance the hand. Otherwise, if you grip, you just end up in this position here. But we also need the muscles on that side to keep our wrist in a neutral position. Okay, so thinking about grip strength, the wrist is strongest and least strained, should be a D there, when in a neutral position. Okay. And so the question is, what is a neutral position of the wrist? And this is probably one of the most important takeaways for everyone today. And that's to understand what is a straight wrist. Okay. I'm going to mention this probably another 5 or 6 times throughout this webinar, that to reduce the risk of an injury when gripping, the employee needs to have a straight wrist. And so the question then is, what is a straight wrist? And a straight wrist is exampled in these images here. So straight through the middle finger, that is a straight wrist. And if you're gripping, it's not with the item being straight, it's actually the item being angled. And we're going to go through that a little bit later, but it's to do with the gripping of your hand and the position of your fingers. And so this is a straight wrist. So this is a straight wrist as well. And this is a straight wrist. And this is really important to look at from the side view as well, is because this is actually a straight wrist and it's at 10 to 15 degrees of extension. And so you can see the angle there, but through the carpal tunnel or through the tunnel in the wrist, it's actually straight. So the tendons are nice and straight through the wrist, even though we're at 10 to 15 degrees of wrist extension. And one way of testing this out for yourself and seeing what is a straight wrist, make a fist onto a bench and you'll be able to see that 10 to 15 degree angle. Okay. And then you'll know that's a straight wrist going through the carpal tunnel. Okay. So deviation from neutral or bending the wrist up, down, or sideways, it actually reduces grip strength by up to 25 to 30% and increases tendon friction. Okay. So if you've got a rope, just imagine a rope going over a rock. And so the rope is the analogy for our tendons, and the rock is the analogy of our carpal bones or the bones of our wrist. If you've got that rope and it's being bent over the rock, and then you pull, you go back and forth pulling on the rope, that rope is going to start to fray. So if you're pulling on the rope and letting it go and pulling on that rope and letting it go, and there's a weight attached to the end of the rope that pulls it back each time, that rope is rubbing against the rock and it's going to start to fray. And that's the analogy of our tendons. If that continues to happen repetitively, then the tendons become irritated and inflamed. We call that inflammation. The tendon will start to swell. And if that tendon swells, you're either going to get a tendon injury, or you could get both. A tendon injury or tendonitis is what we call it if there's inflammation of the tendon, or you could also start to put pressure on the median nerve, which is a nerve that runs through the carpal tunnel in the middle of the wrist. And that person will then end up with carpal tunnel syndrome, which is pressure on that median nerve, which will then cause numbness, pins and needles, tingling, and weakness of the hand across the thumb, the index, and half of the index finger. Coming back to these risk factors that we mentioned previously, we can then see that it's really important that we want to start to get the design of the handle right, or at least choose the right device that your employees are going to be using. So start thinking about the tools that they're using, and are they keeping the wrist straight, or are they forcing the employee to have to bend their wrist when they're doing the task? And the other thing to mention about design is how much vibration is caused by the tool and the weight of the tool. So we're going to start to have a look at those now. So in terms of design, handle angle, the weight of the tool, the balance of the tool. So not only do you have the overall mass of an object that you're holding, but what's the center of mass of that? And that will either keep the tool in balance where you're holding it or throw it out of balance. The vibration is another risk factor, and the hand span. So the design of the tool will create all of these different scenarios and factors that we need to start thinking about. So the first one we're going to look at is handle angle. So as we mentioned, and as illustrated before, the ones here in green, that's a straight wrist, and this is a straight wrist. So the other ones over here, this is not a straight wrist. Just highlight that in red. So we can see that the wrist is bent. And even though that this is horizontal, your wrist is actually bent. Okay. And this is slightly off as well. And that's into flexion. So this one's into flexion and this one's into extension. The wrist is being bent back too much on this. So keep that in mind. And so the handle angle should be roughly 16 degrees at an angle. Sorry, I'll just go back. So the handle angle should be roughly 16 degrees if we're working against an object that's perpendicular to the forearm. And the reason for this is when we close our fingers and we grip, the gripping actually crease is at an angle. Okay. And so you can see here that this tool, or this handle, I should say, is at that kind of 16-degree angle from vertical. And this is perfectly creating a straight wrist for this individual. Okay. And so you need to start with the tools that they're operating. You start to think about what angle does the tool, first of all, have an angle? And if so, if there's two options, which one would be the better option? So the other important thing to remember is that we have in the forearm what's called pronation and supination. Okay. And that's where these two bones in the forearm cross. Okay. And so when we rotate our arm forwards and backwards, okay, when it's fully open or rotated with our palm facing up, we call that supination. When it's all the way facing down, we call that pronation. And in the middle is neutral. So neutral is the least amount of effort required to keep our forearms in that position. So the neutral position is what we want to try to aim to be in. So not only are we thinking about the wrist position up and down, but we're also thinking about, is our palm facing up or down? And so these are the guidelines, the general guidelines with the handle angle. So we do want a straight handle if the force is being applied along the line of the forearm. So if you're, for example, using a staple gun or a screwdriver is another example, and it's against a wall that's vertical against you, then having a straight handle would suit. Oh, sorry. No, it's the other way around. So if it's, for example, a pallet lying downwards, then you'd want a straight handle. If it's against the wall, then you want typically 30 to 45 degrees of a pistol grip handle. The other thing to mention is that if you've got a tool that's double handled, like pliers, cutters, or crimpers, the handle span should allow neutral wrist while closing the grip, and the optimal is 50 to 65 millimeters of span for most hands. So once again, you still need to look at the individual because anthropometrics will play a part. Some people have big hands, some people have smaller hands. If somebody has a smaller hand and they're trying to grip a tool that everyone else is using, it's going to create a lot more force for that individual to try to open up their hand as wide as possible. If it's too narrow, it's actually going to cause some pinching pressure at the end of the tool. If it's too wide, like I just mentioned, it's going to be an overstretched grip, which is going to reduce force and create higher strain. Okay, the weight of the tool is the next thing. So we've just spoken about the handle design, but you also need to think about the weight of the tool. So the recommendations are that the tool should be less than 2.3 kilos. if the hand tool is being used away from the body or above shoulder height. It should be 1.4 kilos or less for tools operated with one hand, 0.4 kilos for precision tools to allow for good control. The tools basically above these recommendations, they should be supported by a counterbalance or a tool holder or an articulated arm. So I'm going to show you an example of what's called a spring balance or a counterbalance. So what she's doing there is just adjusting the counterbalance or the tension of the spring. And then what that allows is matching to the weight of the object. So now it's basically weightless, the object, and because it's being supported by a spring balance. So this is really useful in situations where somebody's working at a workstation and they're going to be using that tool over and over again. You can support the weight of the tool using one of these spring balances. And as mentioned before, the center of gravity also needs to be considered because it determines the balance of the tool. So the center of gravity, the closer the center of gravity to where the hand is gripping. So in this case, the center of gravity is here and it's pretty close to where the person's gripping here. The closer it is, the more balanced the tool's going to feel. If the weight was all the way over here, that's going to increase the distance. And with leverage, that's therefore going to create more force that the person's going to need to apply to hold that object. I've got a nice summary sheet of the tool design and what you need to look out for. So if anybody wants to reach out to me at the end of the webinar, once again, I'll put my email in the chat and you can just send me a quick message and I'll be able to send this through to you. Okay, so we're going to move on to common injuries. So tennis elbow, or otherwise known as lateral epicondylitis, golfer's elbow, medial epicondylitis, carpal tunnel syndrome, de Quervain's tenosynovitis, wrist extensor tendonitis, and trigger finger. These are the most common injuries that we see and that we've seen over the last 10, 15 years doing on-site physiotherapy. And we can categorize these in terms of, are they happening in the hand, fingers, and thumb? Are they happening in the wrist, or are they happening in the elbow? Now, we don't have time to look at all of these. I'd rather just pick the two main ones. And that's what we're going to do today and go a little bit more in depth with those. And so we're going to look at tennis elbow, and we're also going to look at de Quervain's tenosynovitis. Okay, so first one is tennis elbow. So we'll just watch a brief video. So as mentioned, we've got muscles that are in the forearm area and they go up and they attach at the elbow. So where those muscles that produce the gripping attach, we can get inflammation of the tendon. And the tendon is this white part, which is the connection between the muscle belly and the bone. And so you can get inflammation, small microscopic tears of that tendon from overuse. And that's what tennis elbow is. Okay. And so we can see that here. And so what the person will experience is pain at the elbow on the outside of their elbow when they try to grip something. Now, the important thing to mention about these tendon types of injuries, and a broad categorization is called epicondylalgia. If it's inflamed, we call it itis or epicondylitis, but the slang term for it is tennis elbow. The important thing to mention about these tendon types of injuries is that if they're not treated properly, the person can experience this pain for years, and it just really doesn't go away if you don't address the issue. And the answer actually is not complete rest. The answer is task modification, so modifying the load and the task that this person is doing, and slowly building up the conditioning and the strength of that muscle and the tendon over time. And so we can, if somebody does have a really roaring, extremely bad tennis elbow, it'll still take probably about 3 months with physiotherapy to get better. But once again, as mentioned, if it's not treated, that person will have that pain for 2 years, 3 years. Okay. So, what are the main causes of tennis elbow? So, repetitive gripping with wrist extension. So, if somebody's bending the wrist back as they're trying to grip, high gripping forces, so forces that are above the person's normal capability, prolonged work of above those prolonged work of the above requirements. So, yeah, so high gripping forces combined with the repetitive gripping with wrist flexion. So once again, the elbow is not straight, it's bent, and then we're trying to grip. That can increase the risk of tennis elbow. Repetitive gripping with the palm facing downwards. So as we can see here, he's gripping a brick, but his palm is facing down, and that means he's forced to use the extensors of the forearm. And the last one there is gripping with the fingers at maximal stretch. So once again, he's stretching his fingers apart, and that will require a lot more strength through those extensor muscles. So that increases the risk of tennis elbow. Okay, so what can we do? Well, what do on-site physiotherapists basically do, and what can we do to fix this condition or this problem that somebody might present to us with? So the first thing is we can apply a tennis elbow strap. So this is an example here of a tennis elbow strap. And the pain that the person would normally experience would be around this area here. Probably should have put that in red, not green. And so what we're doing with this tennis elbow strap is it's like a guitar string. There's the string there, and we're applying pressure here at this point to offset where the forces are going. So instead of the force going all the way up into the tendon, we're getting it to come up, but then stop at that point there. And so it's applying pressure on the tendon, but before the painful area, and that can help reduce the pain. And we can do that through a tennis elbow strap, or we can do it through rigid taping. So this is a rigid tape that doesn't stretch, or there's a substance called kinesio tape, or K tape for short, and we can use that and apply that along the muscle belly to help activate that muscle a little bit better. Okay. Of course, we've got task modification and technique modification that we can do. And the important thing with tendon injuries, so if you're a healthy person, you've got no pain in the elbow, then stretching is going to be beneficial. So a normal stretch is for the wrist extensors would be something like this, pulling the fingers and the wrist back. But if somebody has a tennis elbow and then you get them to stretch, it's actually going to aggravate it, and it's going to make it even worse. So when somebody already has tennis elbow, we want to avoid stretching. Okay. So the second thing that we can do is we can improve the technique of somebody doing a task. So in these examples here, what we've got is these are wrong. Okay, so we've got somebody gripping, they've got their palm facing down. In this case, we mentioned that before, once again, palms facing down, fingers are maximally opened. So these two are the wrong technique. If we can get our palm underneath and we're holding this brick, he's also flipped the brick upwards, and so he's not gripping with maximally open fingers, and he's now using the bicep to hold this brick rather than having the palm facing down. And in this case, we're using two hands, once again, the palms facing up. So that simple change of making the palm face up rather than facing down changes the muscles that are being used and can help reduce or take the stress off the muscles that are inflamed, which are the extensor muscles. And so these are some examples in real life. So at one of the workplaces, this gentleman was gripping and had to take the wood off the conveyor belt and then stack it. And he's gripping with his palm facing down, fingers are opened, and he's gripping it with one hand. So all the weight is on that one hand. And that's a recipe for disaster for tennis elbow. Okay. And so what we explained to him is that we need to change our technique. It's pushing the wood across, gripping with two hands, and now the arms are facing in, you're lifting with two hands and you're not gripping with the palm facing down and the fingers maximally opened. So this one here is a much safer technique. Again, a very similar process, this time two pieces of wood. And so the technique that we've gone with is to use both hands to grab the end of the wood, pull it towards himself, then get one hand underneath. So now he's got his palm underneath, and therefore he's using his bicep muscles, which are much larger muscles, to lift rather than trying to have the palm facing down and therefore using the smaller muscles of the forearm, which could flare up that tennis elbow. And then he's gently stacking. And so with this technique, he's got his shoulders down by his side. So he's not raising his shoulders. He's in a good posture, a good position. And this is the final example. So in this case, once again, gripping with one hand, trying to pick it up with one hand, palm is facing downwards, which is the error, the risk factor, and the fingers are maximally opened, which increases more strain onto those tendons. And so the change is to then use two hands to grip and also have the wrist straight. So you can see in this example, the wrist is straight, whereas in the other example here, through the forearm and then the wrist is going down, so it's bent, okay? And so that's that analogy once again of gripping and contracting, and you've got the rope going over the rock kind of analogy. Okay, so moving on to the next condition, so de Quervain's syndrome, and this is the last one we're going to cover. So I think we might end up going a little bit over time, but this is the last one. De Quervain syndrome is pain associated with inflammation, which is heat swelling of the sheath that covers the tendon of the thumb. Okay, so we have muscles that originate in the forearm that control the thumb. Okay, so the extensor pollicis longus and flexor pollicis brevis, and they go over and connect into the thumb area, and they're surrounded by this sheath, which if it gets inflamed, it's a condition called Quervain syndrome. And I'll play a quick video. So what we can see is that if we're repetitively using our thumb in a stretched position or pulling our wrist back repetitively, then we can get inflammation of that tendon sheath. And that's Quervain's. Okay. So the cause, as mentioned, it's repetitive gripping with excessive thumb movement and gripping with the wrist bent into ulnar deviation. So we have two bones here. We have, sorry, let's go back. We have one bone here called the ulnar, and we've got a second bone here that goes into the wrist called the radius. Okay, so this one here is called the ulna, and if we're bending our wrist down into this position here, then we call that ulnar deviation. And what's happening there is we're stretching these muscles that are here crossing the thumb, we're stretching those muscles. So they're on stretch. And because they're on stretch, we're going to cause this inflammation. So, as I said before, having the wrist straight when gripping is the most important thing. So this is an example, a real life case study of an employee that has to do some sewing and the wrist is being bent into ulnar deviation, which caused inflammation at the wrist area of the thumb. And you can see so you can see there that the wrist it's not straight, it's being bent. And she's doing that because she's trying to guide the material through the sewing machine. Actually, you can see it a lot better in this one here. So you can see there that the wrist is bent as she's trying to guide the material through. And so the solutions or the fixes for this, we can use a thumb or wrist brace, or we can do strapping as well to try to reduce that ulnar deviation or that bending of the wrist and try to keep the wrist as straight as possible. So there's actually these fantastic braces with a piece of thermoplastic. And what we do is heat up that thermoplastic so it's moldable and it's soft. We then put it inside the pouch, wrap it around the wrist, and then we've got basically a formed piece of plastic that's then strapped to the person's thumb and wrist, and it'll stop them from bending left and right. And in this one up the top here, there would be a metal plate that's in there. Once again, it's to stop the wrist from either bending that way or that way. Okay. Because it's a tendon injury or a tendon sheath injury, we're going to avoid stretching and we're going to aim for modifying or improving somebody's technique. And so this is an example of the strapping that we can do on the spot. So either using the K-tape to support the muscles or using rigid tape to stop that movement of the wrist bending away. Okay, so these are two examples, one example of the wrist being bent. And so what he's trying to do is obviously he's picking up the container of meat or the bucket of meat, and he's not carrying it from a long distance from A to B, but he is doing it repetitively. And so he normally puts it on a trolley, and that's how he kind of pushes and pulls to move it around. He doesn't carry it for long distances. But when he does pick it up, he's grabbing the handles and he's got his wrist bent, and that's going to increase the risk of de Quervain syndrome. And so what we've recommended is try and keep your wrist straight. And he's now got his wrist straight in this photo here. And the way he's done that is we've tilted the bucket slightly so that it's tilting upwards. He's still resting it against his body, but at least now he's got a straight wrist and he's not straining his thumb tendons. And this is another example. So this lady's job was to pick up bags of meat and then put it onto a production belt or a conveyor belt. And so her technique was completely wrong here. She's using a pincer grip to grip the bags and pick them up, gripping between her thumb and the pads of the sides of her fingers, rather than using a power grip. And so We had a physiotherapist train her on the correct technique of how to grip the bag using a power grip. And then the difference is quite obvious. So in this scenario, she's got her wrist bent. That's going to increase the risk of tenosynovitis. But on the picture on the right, she has a straight wrist. So the wrist is straight here, and whereas on this side, the wrist is being bent down slightly there. Okay. So in the transport and postal and warehousing, they do a lot of scanning. And what we noticed is there's different types of scanning apparatus. And these are two different types here. We've got number one over here and number two. And so with this one, the wrist is being bent down slightly, and the operator is having to use their thumb to kind of dial in and press on the buttons and also to scan. And that's going to put a lot of strain onto those tendons and increase the risk of de Quervains. Whereas the better option is number two, which is to have a gun. And that gun is, you can see in this picture on the right here, that once again, the gun is angled, so it's not straight. And that allows a perfectly straight wrist when scanning. And then the trigger is not on top, the trigger is on the side there. And so you're just pressing it like a gun, and that's going to keep a straight wrist. And then to punch any numbers in, you can just use your other hand and look at the screen. And so this, in my opinion, is always the better option. If you've got this, I would change it immediately. So as we mentioned, if you want to reduce the risk, you can apply corrective manual handling techniques. You can improve muscular strength and endurance. Make sure the individual is warmed up is something else that you can do, and maintain mobility and flexibility through muscles and joints. So that's teaching people stretches and self-release exercises. Now, last of all, this is the technique for gripping. So in summary, basically, when you're trying to think of what's the best technique for somebody to grip an object, we want to use the power grip as much as possible, especially when doing any heavy tasks. So reducing the amount of times that you need to pinch grip unless you have to and it's a really light task. Keep a neutral wrist. So that's both with pronation, supination, and the bending of the wrist up and down and left and right. Keep a neutral wrist. Spread the load across the whole hand, not just the thumb and the fingers. Apply only minimum force necessary to control the tool or object. So don't overuse force when you don't need to. Avoid sustained static grips. So release the hand and relax the fingers when they possibly can. We know from the food production industry that the employees that are less skilled will continually grip and hold the knife when they're boning and slicing meat, and the handle is actually hot by the end of the shift. And that tells us that the person needs a bit more training and they're less skilled because they're gripping onto the knife really hard the whole time and not relaxing their hand. Avoid stretching out. So avoid straightening the elbow and then gripping. You want to have a bend in the elbow when you grip. Avoid gripping with the fingers maximally stretched open. And the last one there is avoid twisting the wrist while gripping. So it's similar to grip with a neutral wrist, but also maintain that neutral wrist, don't twist. And if you do need to twist something, then you try to move through the arm of the whole body. Excellent. All right. Sorry for going a little bit over, but that's the end of the presentation. And references. If you guys wanted to reach out and have a chat about something a bit more specific in your business that you're having difficulty with or trouble with, I do a free discovery session. So scan the QR code and we'll be able to discuss that. And if it's across any of the eastern states, Queensland, New South Wales, or Victoria, we'll also be able to have somebody come and have a look as well at what's happening at your workplace. I will take some questions now. And so I'll just close this down. And I think you guys should still be able to maybe see that screen. Maybe I should put it back up. Yep. And I can take some questions. Just put in the chat. Okay, so I've just put my email address in the chat as well. If you wanted to shoot a direct email out to me. Okay, so the first question we've got, is gender a human factor that needs to be considered? Yes, but it's not really the gender, it's just the strength of the person. And then in general, the average or the median grip strength of a female compared to a male differs, it's lower. So whether you want to call it a gender difference or you just want to call it, it's a grip strength difference. I prefer to just call it a grip strength difference. That's something that you need to keep in mind. Thanks, Adam. Appreciate it. There's a lot of contention around lifting mechanics with the lower back and how much it actually matters regarding onset of injury. Do you find the same conversations coming up with the wrist joint given certain positions and ergonomics? I understand what you're referring to with regards to those discussions about lifting mechanics. I don't think I think the discussion is not so much, is there a correct lifting technique or there isn't a correct lifting technique? I think basically, if you watch the webinar on lifting mechanics that I did, it basically does state that there is a correct lifting technique. The contention is whether doing manual handling training specific to somebody's lifting technique actually does reduce injuries. And so that's where the contention is. And from the research that I've done, there's not enough evidence to rule that in or out. And now it's very hard from a physiotherapist perspective to know that there is a correct technique and then not train somebody on it. We still, as a business, Work Strong Health Solutions, we still do teach people the correct technique and make sure that everybody is lifting with the correct technique and look out for it. Now, regarding that to the wrist, specific to the wrist, it's the same thing. There is clear evidence to say that if your wrist is bent while you're trying to grip something, that's going to increase the risk of an injury. And we should be training people on what the correct technique is. And it's just a matter of making that training effective enough to get results. So if you put people in just a classroom and you go through the presentation that I just went through, I don't think that's enough. I think you'd actually need to get out onto the production floor and show them in real time, this is what a bent wrist is, this is what a straight wrist is, this is what you need to do. And you can supplement it as well with feedback. And what we tend to use is strapping and tape. And the tape actually pulls on their wrist when they're bending their wrist. And so they're like, oh, my wrist is being bent, so I need to try and keep it straight. So even something simple like that in conjunction with the training, I think would help. Would it be possible to access the previous recordings? Yes, definitely. Reach out to me by email and I'll send those through. Also, if you go to Work Strong Health Solutions on YouTube, you should see our full webinars there as well. Is it possible to get a copy of this presentation once complete? Yes, the recording, definitely. I'll post that up on YouTube as soon as I can. Will the presentation slide be shared with the attendees? So I won't be sharing the actual slides, but I'll be sharing the recording. So you'll be able to get that. Okay, thank you for the webinar. Very interesting. Thank you. And somebody said, I can't actually see your email. Yes, if you go to the chat. So, Catherine, if you go to the chat, you'll be able to see my email address there. What kind of weight is a cutoff to change grips? Yes, good question. So if we go back to one of the slides, I think it was 2.3 kilos, 2.4 kilos would be the max that you'd want if you're having to reach out or have above shoulder height. So if the object is heavier than that, then it needs to be operated with two hands or you reduce the weight. So 2.3 kilos. Okay. Can't change ergonomics of grip. No, you're right. I'm not sure what you mean there, Nigel. Maybe we can chat about that afterwards. But if you're referring to you can't change the ergonomics of the grip, yes, ergonomics is ergonomics. You can't change what's optimal. The optimal is for the wrist to be straight and in a neutral position. And then it's about changing the design of the tool or modifying the task to make sure that the wrist is as straight as possible. What to do about repetitive strain using an angle grinder? So if the task is going to be stationary and it's going to be at the same point that the person needs to use an angle grinder, then what I'd suggest is connecting the angle grinder to a spring balance and then using the spring balance to support the weight of the angle grinder. You want to increase the amount of friction, so they definitely should be wearing gloves and making sure that their technique is correct when using the angle grinder. Also, something else is using two hands rather than one hand to operate the angle grinder is optimal. Okay. Angle grinders tend to be quite heavy, and you want to have both hands operating it to reduce the amount of strain on the arms. Now, most angle grinders have the ability to attach an attachment, which is a second handle. So one handle that's operating the trigger and holding, and a second hand holding another handle that's connected to it. That should be the best way to reduce the strain. And then obviously you've then got things like time to allow to rest, rotation of tasks. So not getting the same person to do angle grinding the whole day, but breaking it up and then doing a good warm up and then doing stretches or micro stretches in between to prevent the muscles from fatiguing. Now, one thing I didn't mention today, but when you're getting somebody to do these tasks, you want to ease them into these tasks. So you don't want to get somebody off the street, new to using an angle grinder, and then get into work on it all day. You need to gradually build up their strength and their skill level over weeks and weeks. So over a 6 to 8 week period. And then that will allow time for their muscles and tendons to adapt, which will reduce the risk of an injury. I hope that helps, Nigel. Let's find the chat area for some reason. So someone can't find the chat area. Adam just wanted to say good presentation. Thank you very much. Really appreciate that. Okay, if anybody has any further questions, please feel free to reach out to me via email, or you can book in for that discovery session and we can have a chat. Otherwise, it's goodbye from me. Thanks very much. Have a good day.